Good afternoon. Good afternoon. My name is Richard Long. I'm the Associate Dean at the College of Health and Human Services, and it's a great pleasure to welcome you to this event here at the college. Denise, come on down. I welcome you on behalf of Early Washington, who is our dean here at the college, and all of the faculty, staff, and students here at the College of Health and Human Services. A particular welcome to those of you who are at Kalamazoo Public Library. As you know, KPL is hosting a community read event, a Reading Together event again this year. And the book, of course, is Strengthen What Remains, written by Tracy Kidder. And this event is a part of that series of events sponsored by the Kalamazoo Public Library. We host a book read here in the college each year as well, and we're using Strengthen What Remains also as our common read in the college. So welcome to KPL, and welcome particularly those of you who are from the community who've chosen to join us here today. Our book read focus in the college has to do with our desire to increase our interprofessional educational opportunities. We want students to have an opportunity to talk among each other, students in nursing and speech pathology, audiology, occupational therapy, blindness and low vision, social work, all of those disciplines that we work in. We want those students to have an opportunity to talk with one another about what they do and what they're experiencing here in the program. And a book read is one way we have to do that. So we talk about global issues in health, we talk about local issues in health disparities, cultural issues, poverty. All of those have been themes in the various book read events that we've had during the last 4 years here at the college. And this, of course, is that event for the year. And today we have a panel, which I'm very pleased to introduce to you briefly. They will tell you much more about themselves. Carmen Swayze on the far end. Carmen is with the Kalamazoo County Health and Community Services Department. And Carmen is responsible for the maternal and child health programs and the Healthy Babies, Healthy Start program. Next to her, Denise Crawford is the executive director, I believe is the title, of the Family Health Center here in Kalamazoo. Serves a large number of people who live in poverty here in our county. Denise Bowen is a physician assistant and our faculty here in the College of Health and Human Services. Denise has extensive experience in Central and South America in providing health care in a rather challenging situation that she'll tell you about. And finally, Dr. Bill Walker, to my left. Bill is a pathologist at Bronson and has sort of a unique perspective on global and international health through his work to help provide pathology services worldwide to folks who live in impoverished settings. We're going to talk today, these panelists are going to talk about their experiences and they're going to reflect on those as they relate to the themes of the book, Strengthen What Remains. You know the book, if you've read the book, it's about the power of memory, it's about kindness, it's about chaos and death, it's about community, it's about poverty. Many, many themes run through this very powerful book that we have read this year. And I know that our panelists will reflect on those themes, talk about how they play out in their own work. We're going to let these folks make some opening remarks and then open it up for a question and answer. We're scheduled to run until about 12:45. There is a reception following this event in the atrium just out to the left. Please join us after the event for food and conversation. I will say too, if any of you get a parking ticket, please come and find me at the reception and give me the ticket and I will take care of it. So that may be a possibility. One more announcement. Deo, the lead character in the book, Strengthen What Remains, Deo will be at Kalamazoo College on May 16th. He's being hosted, his visit is sponsored by the Arcus Foundation. So please sort of put that on your calendar if you'd like to hear Deo. There are a number of other events. They're all listed on the Kalamazoo Public Library website. So with that, I would like to turn the floor over to our panelists. They all have on mics, and let me know if need to adjust those. Carmen Swayze, could we begin with you and tell us about what you do?
Yes, I'll be back. Basically, I work with infant mortality. We try to decrease infant mortality in Kalamazoo. And as you know, there are two ways to know the quality of life of a place is related to two issues: life expectancy and infant mortality. When our infants are dying, that means that our quality of life is not any good. Unfortunately, in Kalamazoo, we were able to qualify for federal funding to decrease infant mortality and reduce racial disparities in perinatal care. And we get this funding competitively, and we get this funding that comes from the federal government only to those areas that are in the worst possible shape. I'm going to tell you that Michigan has the most number of sites funded by the feds than any other state in the United States. And Kalamazoo is one of the worst places in terms of infant mortality. And to give you an idea, infant mortality in Kalamazoo is higher than the United States. But when we target infant mortality in the city of Kalamazoo, in specifically in the areas that are the poorest areas of the city, like the north side, the south side, the east side, the numbers almost double. And if we talk about infant mortality for African American babies, the numbers triple. So it is very, and I think it is hard to understand the depth of this problem. And I decided to bring you some information, some stats, so that it gives you an idea. When we talk about infant mortality, the United States is in the 33rd place. Every developed country is doing better than we are. And many not developed yet countries are doing better than we are. When it comes to life expectancy, many other countries do better than we do. But when it comes to spending, nobody spends more than we spend. The difference is, and I just chose a few countries just to give you an idea of our despair sometimes. The US, the infant mortality in the US, this is much worse, and Kalamazoo is much worse. And our area is much worse, but the infant mortality is 6.3. And we spent, gross domestic product, we spent 15.3% of our gross domestic product. However, for example, France, that has the Cadillac of healthcare, they have a 4.2 infant mortality rate, but they only spend 11% of their GDP. That is, the French spend $3,500, we spend $6,700, but we have lower life expectancy and higher infant mortality rate. Now, when we talk about infant mortality rate, we're the 33, so along with other countries. But when we talk about infant mortality rate in Kalamazoo for our African American babies, we go to a 20 per rate per thousand, which puts us together with countries that we don't even know their names, like Tunisia does better, Burundi, and a lot of countries do better than we do in the city of Kalamazoo. So I see that as a total tragedy, and I see that we're expending a lot of money, but we are not expending it well. What we're doing and what we're finding out is that mostly the issues are not related to medical care, because we have excellent, like Kalamazoo has excellent hospitals, excellent medical care, but it is really the determinants of health are social and economic. What puts us there are the social, economic, poverty that we cannot compete because we have the same situations in the city of Kalamazoo that we have in countries that are very underdeveloped. And so, even though we have resources, medical resources, the social issues that are not solved will impact no matter how good technology we have in terms of medical care. I know we're short of time, and I'll be glad to answer questions, but I'll leave it there.
Thanks. My name is Denise Crawford, and as indicated, I have the pleasure of working at the Family Health Center in Kalamazoo. The Family Health Center is what is referred to as a federal qualified health center, and you'll see it used in terms as FQHC. And what FQHCs are federally designated primary care homes to ensure that the underserved and that the uninsured population has access to primary health care. So within Kalamazoo County, when we look at the county as a whole, Kalamazoo County has about, give or take, about 250,000 people. Our catchment area, meaning the population that we're designated to serve as the primary health care safety net, is approximately 60,000 of those individuals here in Kalamazoo County. So about 30%. When we look at the breakdown, it's extremely interesting. About 30% of those individuals receive Medicaid, and that's for adults as well as children. And about 30,000 of those individuals receive Medicaid. And another 30,000 of those individuals are completely uninsured. And so, once again, the federal government establishes organizations such as ours, clinics, and we actually have 6 of them across Kalamazoo County, so that people that have Medicaid insurance or that are uninsured and have no insurance whatsoever have a place where they can come and receive primary health care. So whereas that's a phenomenal thing and Kalamazoo is very lucky to have it, we are not even beginning to make a dent in that population. Fortunately for us, we recently received approximately a $9.6 million grant to expand. And the reason being is we are at maximum capacity. We see patients Monday through Friday, 8 a.m., 8 p.m., 12 hours a day, as well as Sunday hours, and have completely exhausted our capacity to really reach any further patients. And currently, of that 60,000 in Kalamazoo, once again, including adults as well as children, we're serving about 20,000. So there's a 40,000 gap of individuals in our community right here in Kalamazoo County who really do not have access to quality or even any form of primary health care other than the emergency room, which is really the most expensive type of care, and it's really hard to get a continuity and appropriate prevention through an emergency room. So I think that's what I will be speaking about today. That's my area of expertise. As far as visits, currently we have approximately 75,000 visits. We offer the services so that you understand when I say primary care, that's anything from pediatrics, family practice, internal medicine. So as we describe it, it's on the ambulatory side, which is anything outside of the hospital. So as you go to your general practitioner just for your physical, as women go for their annual pap smears, as pregnant women go for their prenatal visits, those are the services that we provide. Children's well child visits, those are the services that we provide on a daily basis.